Well, March is a month dedicated to colon cancer awareness. It comes at the exact same time that a new study confirmed a significant increase in colon rectal cancer cases for millennials and Generation X adults. So joining me today is Dr. Bruce Woldholtz. He is the past chair of the American Cancer Society, and he's going to talk to us about why the increase. You and I have spoken about this many times before. Why is this particular study such an indictment?
Well, this study is very important. It comes from the American Cancer Society Epidemiology Unit from Dr. Rebecca Siegel.
Okay.
And what she did is to look at 5-year groups of patients and ages over a 40-year period.
Wow.
And we know that the rates overall, particularly in people over the age of 55, have been going down. But when she broke it down, she realized from this study that people in their 20s, 30s, and 40s have a higher rate than any time ever since almost 100 years ago of people developing colorectal cancer. They hypothesize that it's due to the increased risk of obesity, poor diet, and inactivity. So the concern is that moving forward, as people in those age groups age into the next decade of life, the rates will actually be going back up.
So Ryan Beard, rest in peace, one of our former co-workers here, diagnosed at 33, I believe, passed away at 34, and his diet through treatment was actually not as healthy as you would think it was for someone that's told the way to prevent this is to eat roughage and eat healthy. Why is that, Doc?
Well, it's certainly tragic when somebody passes away at that age. The first thing is, the message should be, if anybody has any symptoms, rectal bleeding, abdominal pain, change in bowel habits, to see their physician, because people do get colon cancer at young ages. Number two is to continue to remember to know your family history. Because while everybody should be screened at age 50, that's what we call quote-unquote average risk, which is still a 1 out of 16 risk lifetime of getting colorectal cancer. But patients with a family history of cancer, polyps, and a first-degree relative should be screened at 40 or 10 years before the age of the relative.
But what do you eat to prevent this?
The best thing is to maintain a healthy weight by whatever mechanism. Certainly, everybody agrees that 5 fruits and vegetables a day, keeping a healthy weight, limiting red meat would be very helpful. But if we look at the rates of obesity in the United States, the American Cancer Society had a study called Cancer Prevention Study 2 in the 1980s, where they looked at 1 million people, and the risk for 10 cancers increased almost linearly as the weights go up. So the message would be, know your family history, keep a healthy weight, and there perhaps may be, this is only one study, and it's not going to change guidelines at this point, but there's usually over a period of time continual review of what the guidelines are, and perhaps at some point in the future maybe looking earlier at what we consider average risk people now, but perhaps people born in that cohort, and perhaps an additional risk of being overweight.
All right, thank you, doctor, for joining us
Thank you
today.
so much again, Lucy.